Today's healthcare facilities share two primary goals: improving patient outcomes and increasing operational profitability. We are American Green Technology, a leader in energy-efficient lighting and now the exclusive provider of the health risk management system. This revolutionary and patented product will provide you with the opportunity to meet both of these primary goals. Let's first address patient outcomes. Hospital-acquired infections are a growing problem, and according to the CDC, the Centers for Disease Control, adds approximately $45 billion to our national healthcare costs. These infections are now responsible for an estimated 99,000 deaths annually and is now the fourth leading cause of death, greater than AIDS, breast cancer, and automobile accidents combined. Every infection preventalist is tasked with the development, implementation, and execution of infection prevention protocols, a monumental problem that finds many of the infection-causing pathogens becoming resistant to traditional disinfection methods and products. The CDC recommends 4 hierarchies of defense when fighting HAIs: pressure, filtration, purification, and dilution. We are here to introduce you to an unobtrusive device that combines these 4 recommendations into a single product that is effective at neutralizing HAI-causing pathogens at the source of infection. The HRMS is an environmental disinfection system designed as a light fixture that can be installed easily into your existing ceiling. This energy-efficient platform provides excellent distribution of light from the patented smart fixture housing, while in a 2-lamp configuration consuming a mere 45 watts of energy. There are 2 vents on the face of the fixture. Behind one of these vents is an array of fans, which create a differential pressure to draw air from the space. This differential pressure does not affect the negative or positive pressure designed into the healthcare facility, but does act to isolate the contaminants in the air. We draw the air through a MERV filter, which removes larger particulates of dust. This filter is designed to keep the UV lamp operating at peak energy emission and is not designed to trap pathogens. We want the pathogens to flow through the filter and on to the next stage of our system, then forcing the air at 50 cubic feet per minute into the radiation chamber mounted on the back of the fixture. The air now moves through a set of safety baffles which prevent the UV light from escaping the radiation chamber. Once in the radiation chamber, our high-intensity UVC lamp operates at the peak wavelength of energy emission at 253.7 nanometers. The HRMS provides 100% single-pass removal rate against 30 HAI-causing pathogens. The purified air is then returned to the space through an additional set of safety baffles and out the opposing grill, which has a 30-degree angle on the blades to force air throughout the room. The CDC recommends dilution as the 4th line of defense, and our device operates 24 hours per day, constantly changing and purifying the air. In a 10 by 10 room, we will change the air an average of 4 times per hour. Ultraviolet technology has been studied for over 80 years and is unquestionably a reliable means to fight infection-causing pathogens. There are several products on the market that provide portable surface disinfection using ultraviolet rays. However, unlike the HRMS, none of these products can be used when the space is occupied. Consider closing off a portion of your facility for as much as 2 to 3 hours per cleaning. Some of these products require the room to be sealed prior to usage, and in some cases, annual maintenance cost can be greater than $1,500 per system. Additionally, once a surface disinfection product is removed from the space, the HVAC system continues to bring in air that has not been treated, and patients and healthcare workers can reinfect the space virtually immediately. Many hospitals have adopted UV technology in the HVAC ductwork. This is an excellent use of this technology. However, the primary purpose of in-duct and on-coil UV products is to eliminate biofilms on the coils, to improve the energy efficiency of the air handling unit. The added benefit is that these UV products also neutralize some small percentage of airborne pathogens. The key to the effectiveness of UV is the duration of time the air comes in contact with the UV rays and the intensity of the UV output. The airflow rate in most HVAC systems is between 400 and 1,000 cubic feet per minute. With this volume of airflow, the UV lamps in a duct do not provide an adequate protection against these airborne pathogens. The HRMS is designed to work unobtrusively in the ceiling of a space 24 hours a day, 7 days a week at the source of infection, where your patients and healthcare workers are present. Hospital testing has shown the HRMS reduces and controls concentrations of microbes from both air and surfaces. Now let's look at the operational profitability. The energy consumption of the HRMS and all of its components is equal to or less than the existing lighting fixtures in most cases. In addition, it is easy to maintain, with lamp and filter replacements only once per year. With a failure indicator light that is visible through the lens of the fixture, your staff can easily determine that the UV lamp is operating properly with a simple visual inspection. If the indicator light is not on, the system is operating properly. If the indicator light is lit, then the UV lamp or ballast needs to be replaced. The HRMS is the most cost-effective system on the market. We are a fraction of the cost of the portable surface disinfection systems we previously mentioned. You now have the opportunity to install this defense system in emergency rooms, intensive care units, isolation rooms, surgery recovery rooms, burn units, and operating rooms, just to name a few. Dr. Władysław Kowalski is one of the world's foremost authorities on airborne pathogens and nosocomial infections. In his evaluation of the HRMS, he writes, "It has become increasingly clear that airborne and surface-borne HAIs are interrelated, and that air contamination contributes to the surface contamination and vice versa. Therefore, any disinfection system such as the HRMS that addresses both air and surface pathogens will likely have the most effectiveness in reducing HAIs." With the elimination of just one HAI, your facility will reduce operational costs, pay for the system, and increase the operational profitability. Installing this effective system will reduce the risk of HAIs and provide your facility and staff a safer environment and your patients with the treatment they deserve. The HRMS is brought to you by American Green Technology. For more information, you can find your American Green Technology representative on our website at www.americangreentechnology.com. To learn more about AGT's Health Risk Management System, visit agthrms.com.